Hello, I am so happy to welcome Mala Cunningham, who is a counseling psychologist and an assistant professor at UVA. And she has so many wonderful things that are happening that we're going to tell you all about. But before we get started, I just want to talk about a course that Mala and I are going to do together, which we did it last year. So this will be our second time, and I hope we'll continue to do it long term. It's called Mental Health, Brain Science, and Yoga, and it's a joint venture with Yogaville. And this year, 2021, it's going to be July 28th through August 3rd. It's a pretty extensive online program. And we just had such a great time last year teaching mental health, brain science, and yoga that we decided to do it again. So if you'd like to join us, Mala and myself, we're the only two teachers. Please go to yogaville.org. And Mala also has another really exciting project that she is just in the last days of, but I'm sure she'll run it again through her Positive Health Solutions company. And that one is the first neuroscience and yoga teacher training program. And so we'll talk more about that as we get into our podcast, but I just wanted to pop that out there too, to let people know that you're actually training yoga teachers how to teach yoga with the educational perspective of neuroscience. So welcome, Mala. Thank you for coming today.
Thank you. It's so great to be here, and it's even nicer to see you. Haven't seen you in a while, so it's really nice. Thank you for having me, Amy.
Yeah, we are twin Virgo sisters.
Yes, absolutely.
Sometimes when you work with someone on a project, it's just such hard work. Like you just have different perspectives. And I feel like with you, Mala, I don't know if it's the Virgo thing or what, but we just get it, get each other.
Yeah, we're on the same page and it just flows.
Yeah.
So, yeah. And it's also nice that we both have a background in more classical yoga training. So,
Well, say a little more about that, because I think that's unique to have someone who's interested in neuroscience, mental health, the brain, and yet we both come from an actual lineage and tradition. I think that's a unique combination. Tell us more about that.
Yeah, absolutely. I got involved in yoga at an early age, back in the early 70s. And a friend of mine was just given the book, Autobiography of a Yogi, and gave it to me. And it was like all of a sudden all the doors opened up. It was a wow moment. And I became involved a little bit with the Paramahansa Yogananda organization, and I would get their meditation instructions and guidelines and all of that through the mail. And I would sit and do it myself and try to figure out what I was doing. And from there, I found that the Himalayan Institute of Yoga Science was not too far from where I lived in the Chicago area. So I became very involved in that organization for a short period of time, maybe like 7 years or so. And that was at a time when all of a sudden people were really interested, the Menninger Foundation and so on, they were very interested in finding out a little more. What is meditation? What's higher consciousness? What does yoga have? What impact does yoga have on the body? Things like that. So from that angle, I was involved in sort of classical yoga from a lineage, and then became more involved and more long-term involved with the Integral Yoga Institute, Satchidananda Ashram, and studied in India. Went on 3, 4, 5 trips to India and studied at ashrams there and so on. But there was always the beginning pieces of my practice in yoga. There was this little bit of an element of research, exposure from the Himalayan Institute, and then getting involved with the Integral Yoga Institute more long-term. Dean Ornish's work on reversing and preventing coronary heart disease, on prostate cancer, using yoga for Alzheimer's, see what impact it has on Alzheimer's disease. So throughout my whole process, and of course going to graduate school and doing research in this intersection, so there's always been both elements of this background from more of a classically trained yoga instructor, and then all of a sudden just all this input with neuroscience and research and such.
What I'm finding is so interesting is that this more lineage-based yoga really focuses so much on subtle elements like mental emotional intentionality, as you call it. I call it bhavana or visualization, which we're going to talk about in this podcast a little bit.
Yeah.
The idea of having faith in something, or shraddha, whether that's faith in yourself or the divine. There's these elements that Western science haven't really been able to measure or prove, but we know they shift people really deeply. And so that's where I think the rub is that, we don't even have the scientific measurement tools to research some of that. And that doesn't mean it's not true. It doesn't mean it's not working. It just means we don't have the tools yet. So for me, that's really fascinating. And I think we're going to get there. It's only a matter of time. It's happening.
Yeah, absolutely. I think, we have some rudimentary type tools, like I'm thinking of Kirlian photography, where they can see our auric field and things like that. And we know that there's an electromagnetic energy field within and around our bodies, and, with gamma brain waves and beta, alpha, theta, delta brain waves. So we're getting there. We really are getting there. And I think that's what's really exciting right now, is that we are on the cusp of finding out more about consciousness and how it infuses into matter, i.e. our brain, our body, and how we can use consciousness as intentional practices. And actually, just to say that Dr. Lipton is a researcher, a neuroscientist who really does focus on what is the role of consciousness into, the whole field basically of epigenetics. What is the role of consciousness related to how we can impact on the physical body, mentally, emotionally, and so on. So it's an exciting time.
It is. I love Dr. Bruce Lipton's work. And so I just want to ask you, when you are assistant professor at the, University of Virginia School of Nursing, are you allowed to talk about these very subtle tools and also subtle concepts in terms of spirituality and consciousness? Or is that kind of like, it's not 100% scientifically proven, so let's not go there yet?
Right. That's a great question. And to be honest, for a long time, I went to graduate school in the early 80s. And for a long time, I would bridge these concepts of yoga and psychology, or yoga and medicine, and so on. But I would keep a certain distance with my own personal practice, and I'd try not to go too far. And I got tired of straddling two worlds. And there was a point that I just decided I'm going to bring to the table my wholeness around my belief system, about what I was going to do professionally, how I was going to teach. Now, granted, I think it's very important to be respectful of the arena that you're walking into. I think that's very important. And to not push the envelope in too dramatic of a way, but step by step to just bring concepts forward. So one of the things, just as an example, one of the things, like if we just think of the 5 koshas, the sheaths, the physical body, the nervous system, this is how I format it: the physical body, the nervous system, emotional body, the mental body. And then that 5th sheath always gets tricky. It's the Anandamaya kosh, for those who may want to know the Sanskrit angle on it. But that Anandamaya kosh, it's the blissful sheep. So, what in the world does that correlate with? It's like sometimes I think we really struggle with that. For those of us who were interested in higher consciousness back in the 70s or 80s, and we wanted to meditate because we wanted higher consciousness or the enlightenment. But how do you define that? And what does that mean? And where is it in the brain? So, what I've done, which I think has been very helpful, is for those people, when I'm teaching this in a university setting or other places, um, what I do is I try to make things really practical. That whole Virgo mentality. We like
Yeah,
things practical.
we sure
So,
do.
yeah. So, um, so I say to people, if you have a spiritual or religious um, framework that you adhere to, then that's what this realm is about. And how do we bring that into our daily living? If you don't, then just reformat it into, how do I, as a person, become more compassionate toward myself and others, have more empathy toward myself and others? How do I find that sweet spot of walking through my day more balanced, more kind, more compassionate, and having a moral compass? So I think there is definitely a space where we can bring the yoga practices, whether we use the terminology from yoga or if we have to use slightly different terminology to mean the same thing. Honestly, I think the field and the research and the neurobiological research that's being done on compassion and empathy can mean the same thing as the Ananda Maya Kosh. So that's how I'm sort of translating it in my mind. But what do you think?
Well, first of all, I just want to say I think you and I, and there's many others out there too, are actively searching for ways to translate these very deep ancient concepts into modern terms that Western healthcare and medical will accept. I mean, I've never given a lecture on chakras. I've never,
Right.
I'll do what the Deskachar tradition does. And, the first chakra is your elimination. The second chakra is, that there's actual physical structures, which isn't the classical way to look at
Mhm.
chakras, but it's something that people can kind of grasp onto and hold on to. And so I agree with you. We have to speak to people in a language that they can understand and in
Yeah,
concepts that they can understand. And oftentimes that means taking it a little bit out of the very subtle realms and
right.
like you said, making it very practical.
Yeah. And that's why, to be honest, Amy, some people sometimes they go, well, wait a second, the pranamaya kosh, that's more prana, chi, the nadis. Yes, it absolutely is that, no doubt. But for someone like a heart patient that comes to me, because that's one of my specialty areas, that comes to me for medical yoga, that comes to me for lifestyle change management, they are so not interested in esoteric, subtle concepts. They want something concrete. And that's why I have formatted the pranamaya kosh as the nervous system, because it really is the nervous system, but it also is much more than that.
The
So,
nervous system are some of the largest nadis in the body that are gross and
yeah,
tangible, right?
yeah, absolutely. Absolutely. So I think it just makes sense when you're navigating the medical world and the academic world. And like with my private practice, also, I have to be respectful and start where people are at. And then slowly I can provide tools and techniques and concepts to help them to heal and understand what it means to heal. So,
And I think, both of us coming from more of a traditional lineage based yoga, we're not denying that this is
right,
yoga. We're not pretending that it's something else. We truly do have our hearts really, really deeply connected to the ancient teachings and giving credit. We just
Yeah.
also know that we don't have to lead with that.
Exactly, exactly. Yeah, I think again, it has to be something manageable and practical, especially if someone has never been exposed to yoga or medical yoga or therapeutic yoga. It's like, what does that mean? So yeah, step by step, manageable steps, I think, are important.
I have a colleague that told me she works with high level medical people, but also very traditional yoga people who are saying that yoga therapy, or as you say, medical yoga, is basically a bastardization of the ancient teachings, and we shouldn't be doing this. And it should be about enlightenment. It was never meant to be about health and healing. Well, what I know that's a hard question, but I think we need to, instead of pushing these hard questions away, I think we need to pull them in and answer that for ourselves. So, do you have any thoughts on that? I've thought long and hard about it, but what do you think?
Yeah, well, a couple of things. One is that, I've done this big, huge slide presentation on the history and origins of yoga. So, just as an aside, if someone wants to see it, it's free. It's on my YouTube channel under Mala Cunningham. Um, and I was just fascinated when I was studying this and looking at the origin and the progression of yoga over the centuries. And one thing that, just really stuck out was that originally, as you may know, and many may know, the yoga practices were strictly used for enlightenment, nothing else. The body many times was overlooked and just basically absolutely ignored. And you see people laying on a bed of nails and things like that, just in the process of overcoming any connection to the body. And it was strictly they only did poses that would emphasize the enlightenment track. Yoga didn't look anything like it looks today, like
Like
nothing at
a
all.
very
Yeah,
dualistic kind of separation of the body and the mind, and they're
yeah,
only concerned about the mind.
yeah. So yoga, if you look at that slide presentation, many people don't know this, is that many of the practices in yoga didn't come about until around the 1930s or 40s with the whole advent of the physical culture era, where people were doing calisthenics and sort of military kind of calisthenics, things like that. And I believe it was, wasn't it Krishnamacharya, if I'm remembering correctly, that sort of began to synthesize a more active process of yoga. It's when the sun salutation was formatted and
Mm.
all of those kinds of things. So it's an interesting process. And I fully embrace and respect the history and the origins of yoga. I think there's absolutely a place, but yoga is also on a continuum. We can't forget that. And that people have a difficult time. I think that if we start here and we want enlightenment, that is a huge jump to ignore the other parts of who we are, the body, the emotions, the mind. And to be honest, that's what I did. When I first started practicing yoga, it was all about enlightenment, because that's what I was told yoga was about. So I jumped over all of these areas and just focused on enlightenment. But being a Virgo, we're more, earth, solid, practical individuals. It was too big of a jump. I literally had to go back and go through the body, through the nervous system, through my emotions, through my mind, and deepen into the subtleties of those koshas to find my way to a deeper level of peace.
I'm 100% with you.
Yeah.
And there's so much work to be done on the physical layer, on the layer of the nervous system, rebalancing, watching our minds. I mean, these are lifetimes of work. And my personal feeling is the people that have kind of jumped over all of those and just decided to only do enlightenment, they're actually having some pretty major struggles around being human, around taking care of their physical health or keeping
Right.
their nervous system in balance, or and if we don't have our yamas and niyamas, our personal disciplines and the ways that we interact with each other socially, if we don't have those in alignment, we can get ourselves in really big trouble thinking we're close to enlightenment or enlightened when really there's so much work that needs to be done.
Right. And
Right?
we have to give attention to those things. And they're, what I came to realize from basically what you're saying is you cannot bypass. You can't bypass. You have to go through it to get to the other side. And then it gets resolved and we can go to the next step. So,
And I find people are so impatient, myself included, like, oh, I've checked this box and now my nervous system is in balance and now I can. It's really, to me, it's not like that. It's much more cyclical where
mm-hmm.
I'll be in balance for a while and then I'll be out of balance for a while and I'll have to go back and look at certain areas of my life
Yeah,
and fine tune them again.
absolutely. Because each new experience that we encounter challenges us whether we're balanced or in alignment or not. And until we go through that initiation and that challenge, we're never really going to know whether we're truly in balance. We can hope that we are, but then it can knock us off kilter. So,
And this is why I love this chosen topic of mental health, neuroscience,
yeah.
brain science, because I feel like that is the exact intersection of where the ancient teachings can meet medical science. Now that we're learning about the vagus nerve and vagal tone and vagal syncope and dysregulation of the nervous system, to me, that is the sweet spot between the two worlds that we can do so much about with our yoga practices. So, is that how you came to make this your main focus?
Yes, and I think there was maybe a little more to it than that. When I was in graduate school at the University of Wisconsin in Madison, one of my colleagues there had a heart attack, and I was already a certified yoga teacher and very passionate about yoga. Again, had studied in India and blah blah blah, and I was so struck by his recovery process in the fact that he was depressed, he was anxious, he was only like 40 years old. And he was going to cardiac rehab, but they only did physical exercise at that point, maybe a tiny bit on diet, but that was it. There was nothing else. And I just realized, wait a minute, yoga impacts on the balancing of our mind and our emotions. Why are we not using yoga for in cardiac rehab and for cardiac recovery? So it was really, that was a seminal point in my thinking and development process in terms of bringing yoga into cardiac rehab programs. And I did that through the Midwest, a little bit here and there, but I was almost ahead of my time. They were kind of sort of interested, but not completely. So it really wasn't until maybe the mid 90s that in my practice of putting together a program for heart patients and then developing the cardiac medical yoga teacher training program, that's when also many individuals, Herbert Benson out of Harvard and Dean Ornish and other researchers were really looking at the relaxation response and how yoga can impact on the reversal and prevention of coronary heart disease. So the stepping stones for me, I think number one was my curiosity, because I always wanted to know how and why yoga worked. I didn't want to just accept that there was this impact on me. I wanted to know why and how there was this impact on me, and what were the mechanisms that were making this impact happen. So number one, it was my curiosity. Number two, the cardiac medical yoga program and teacher training program was like a stepping stone for me to then begin to just even go deeper. And then when many of the researchers were looking at meditational aspects and what's going on in the brain during meditation, like actually at the University of Wisconsin, Dr. Richard Davidson was one of the earlier pioneers on bringing the Dalai Lama into his lab and other monks into his lab to look at what's going on in the brain in the meditative state. So just that whole curiosity. And then it just kind of took off. Many labs and researchers around the world just began to look at what are the mechanisms that rewire the high stress response or the toxic stress response, or what's activating the toxic stress response, and how do we begin to manage it. So I think from a lot of different angles, including the angle of neurotheology, and what are the neural mechanisms that are going on in the brain while we're meditating. So like Andrew Newberg, who is, I'm not remembering what university system he's at, but he's one of the pioneers in the field of neurotheology. So I think from a lot of different angles, I think there was just this crescendo of bringing yoga more into academia, into clinical care, and into research. It just sort of began to happen, honestly, in the late 80s, early 90s, with the advent of the National Center for Integrative and Complementary Medicine, when that became a national center. And then it was there forever. They weren't going to have it go away, so. Anyway, I don't know if that answered your question.
Yeah, it really, it's so interesting because in the yogic teachings, we say the mind is in the heart. So here you started with cardiac care. You knew there was something more that could be done besides get on a treadmill for 12 minutes and keep your heart in this special range of beats per minute. You knew there was something more, even more than diet, that there was something to do with consciousness, with nervous system regulation, maybe even with mental, emotional intentionality, or what I call bhavana, right? So you could understand that there was so much more we could do for people. And then over all these decades and decades, you've really honed in on neuroscience.
Absolutely, absolutely. And I have to say, probably similar to you, neuroscience is my passion. I mean, if I'm, in a group of people and someone says something about neuroscience, I'm just like all in. I find it exciting. I find it so fascinating, and definitely explains why and how yoga works. And I think what's so beautiful is that neuroscience can inform not just our personal practice of yoga, but I think it can inform how yoga teachers actually teach yoga. In my classes, whether they're regular yoga classes or medical yoga classes or cardiac medical yoga classes, I always do educational moments because I want to help the students or the patients, whoever I'm working with. I want to help them to understand what it means to connect the dots. Why am I asking them to do this particular breathing practice? Why am I asking them to do a specific type of routine or postures? It makes a difference instead of just blindly, okay, here everybody, here's a script, here's a standard class. It really, I think, wakes our whole practice up and informs us on a much deeper level how and why this process works. And I think that's why I'm so excited also, is because, like, just as an example, out of UCLA, Dr. Feldman, neuroscientist, researcher, he he's been looking at the respiratory and breathing mechanisms that relate to, first of all, like, how does that affect emotions? What is a normal breath? How do sighs happen? You know, there's all these ways that he's looking at the respiratory function and what gets activated in the brain. So his research, for those of you interested out there, I would definitely recommend that you look at his research out of UCLA.
What's his name again? Say it.
Yeah, it's Feldman, Feldman, and he's at UCLA. And he does a lot of research on what's called the sighing mechanism. It's the pre-Botzinger complex is how he has formatted that, and that's what he calls it. And what he found in researching the respiratory process in rats and then also in humans is that on average, we sigh about every 5 minutes, which I think is really fascinating because we're not even aware of that. And our system is sort of doing it automatically. We might be sitting working at our desk and all of a sudden, you know, we might do something like that. Just, you know, but the fact that we do it about every 5 minutes, about 12 times an hour, I find really fascinating. And why he's so interested in that is because when he stopped the mechanism of rats not sighing, it compromised the alveoli in the lungs tremendously, and they became very susceptible to issues and problems, their immune function reduced, all sorts of things. So this psi concept and idea is so important. And so there's different breathing mechanisms that help contribute to that process so that we can have healthy alveoli and not have them compromised and collapsing. And just one, I'm sorry, just one, yeah, just one more real quick thing. What they also found is that when these alveoli are compromised, that what happens is that it starts to activate more of a stress response and sympathetic arousal response pattern. And when we have that happening, then we have a bit of an overload of carbon dioxide in the system because we're not exchanging the gases well. And when we have that overload of carbon dioxide in the system, it creates and impacts on us being jittery and edgy and just not centered and more balanced. So it's a ripple effect, you know. Anyway, yeah, go ahead.
That's exactly what I was going to say, that, you know, there's certain breath ratios that really enhance the gas exchange, the O2 and the CO2,
Mm-hmm.
not
Mm-hmm.
only in the alveoli in the lungs, but also the capillaries in the tissues of the body, right?
Yeah.
So
Yeah.
just being able to breathe like at a 5050 ratio, which isn't even a very long breath, right?
Mm-hmm. Mm-hmm.
I mean, for some people that might be long, but for most
Yeah.
yogis, it's not. That you're getting better gas exchange, then that has these feedback loops to your nervous system, to your endocrine system, to
Yeah.
your immune system. I mean, what they're starting to discover is amazing to me.
It is. It's exciting. It's
It
very exciting.
is.
Yeah. I mean, they know, and many people may already know this, but when we inhale, we're activating a part of the brain called the locus ceruleus. And that's a part of the brain where we're seeing a lot of norepinephrine activation receptors in that part of the brain. So we know that when we're inhaling and that part of the brain, the locus ceruleus, is activating, we know inhalation is correlated with sympathetic arousal, which just sort of makes sense in general. And when we're exhaling, it's correlated with parasympathetic, vagus nerve activation. So interesting that neuroscience, again, is giving us a foundation for understanding the yoga practices, you know, in just a much deeper way.
It's like you said, it's just a really exciting time to
Mm-hmm.
see the research helping to show what the ancient rishis knew.
Right.
It's so exciting. So tell us a little bit more. You talked about the mechanism, that really being able to pinpoint the mechanism. And we just talked about one, which would be, breath patterns. But let's talk a little bit more about vagal tone, vagal syncope. Um, Tell us more about that. I think it's such a hot topic. Everyone wants to know.
It is a very hot topic right now. Actually, what I would love to do, if you and everybody wants to do a little just 15, 20-second technique,
Sure.
that I would love to show you, just again, a quick way to activate the vagus nerve. But before I do that, I'd maybe just like to preface it by saying that when I teach about the vagus nerve and neuroscience and so on, I use the analogy of a gas pedal and a brake.
Mm.
So if we're in our car and we have the gas pedal on to the floor, or not even to the floor, just on all the time, that's not so great. How do we stop? How do we stop that activation of energy? Well, obviously you have to put on the brake. But on the other side, if we have the brake on all the time, we can't get anywhere, you know? So there has to be this nice balance between the gas pedal and the brake, and a flow to that process. So one of the things that I know in yoga, many people start to embrace this concept, which is, I need to be relaxed. I need to be so sort of down regulated. And that is not, in my opinion, that great.
I
We,
agree.
yes, yes, I really would love to change people's concepts about that, because at around 8 o'clock in the morning, our cortisol levels go up, our melatonin levels go down. In the evening, 10 o'clock or so, our melatonin levels go up, our cortisol goes down. So we need a certain amount of arousal. We can't be immobilized and just sort of in this place all the time. That's not realistic. We have to have some dynamic energy activated. So I always talk about the parasympathetic nervous system, the ventral vagal complex. I talk about it in a range. It's not a line of demarcation.
Right.
And neither is the sympathetic or the dorsal vagal parasympathetic complex. That's not a line of demarcation. I like to think of it on a whole continuum, that when we go to the far ends of the continuum into sympathetic over arousal, that's not good. We can visit there because we're just human, but we can't live there. And the same on the other end of the continuum, when we're in that parasympathetic, you're bringing up the slide now, the dorsal vagal complex. Again, we may occasionally visit there, but to live there is not very good in general for our health. So no matter where someone is on that continuum, we have to figure out where are we living, and how can we bring ourselves back more to the parasympathetic nervous system, the ventral vagal complex, where we have a nice balance of arousal and dynamic energy and calm, centered, balanced energy internally. How can we have a nice balance between those two? Now, again, being human, yes, we're going to visit those outer ends of the continuum. But the trick is to not live there. So if we're in aggressive energy, not so good. That rajasic guna overactivation. When we're in the tamasic guna, that passive overactivity of immobilization, clinical depression, not so great. What techniques and tools can we use to get back in the range of the ventral vagal complex? So that said, I was going to show you I was going to take people through a little technique just to activate their vagus nerve and find out how easy it is to begin to impact. So Quickly, the vagus nerve starts at the 10th cranial nerve right behind the neck, and it wanders through the entire body, all through the torso, and it innervates just about all of our major organs. So everything is being affected by that vagus nerve. So we're going to impact on the vagus nerve through these afferent and efferent fibers that connect out into places like the eyes, the ears, the mouth, the throat area, and so on. So if everybody could lace their fingers and put them behind the head and just have a little pressure against the hands, not too much, just a little bit. And if we turn our head to the right and just wait there until we sigh, yawn, or take a deep breath. So for some, it might happen quickly. Others, it might take a little practice. And then let's gently turn to the other side. Again, we have just a little pressure there. And we're waiting until we sigh, yawn, or take a deep breath. And then gently come back to center point. And for most people, it happens fairly quickly. I had someone do this one time and she could not stop yawning. It was really kind of fun to see the quick activation of the vagus nerve. So there's lots of things we can do related to the vagus nerve. If we, I think I sent you a little slide on the uvula. So
bring that up. That to me was fascinating. I really want to understand that because I have seen that in my own throat before. I looked this morning and I'm not having it, but there has been times it was shifted over to one side and I was like, what is going on?
Yeah, it's kind of fun to really take a look at this. But that piece of flesh in the back of the throat is related to ventral vagal nerve dysfunction or dysregulation if it is off to one side or the other. We basically want it at center point. But again, if it is off to one side or the other, it is an indication of dysfunction of the vagus nerve, the ventral vagal nerve. And so that's one of the ways that we can look at our vagus nerve and find out what's going on with our vagus nerve and see if it's dysregulated. When you go to the doctor for your yearly checkup, one of the things that a doctor does is they check the gag reflex. So if our gag reflex is off, that's potentially another indication. If you have a hoarse voice, if you're somehow compromised, there's so many different ways that we can take a look at the dysfunction, and we're also just beginning to understand this process. So there's so much more that we have to understand and know about, but doing the yoga practices, doing the pranayama and the postures, as well as intentionality when we set a sankalpa, energy follows intention. So intention and then attention, because we want our attention there, is so powerful. To me, those two mental processes are really important and set the stage for healing to start to happen in the body. At the University of Wisconsin in Madison, Davidson's lab, they're looking quite a bit at attentional faculties and what a difference, which is drishti, of course, in the yoga tradition. They're looking at attentional faculties and what differences that makes in terms of the amygdala flaring, which is the threat center in the brain. Does the amygdala start to deactivate and calm down and even change its structure? Because they did find that larger amygdalas were present in people who had high stress levels, toxic stress, after they had gone through an 8-week mindfulness meditation training. Literally, the structure shrank. So fascinating. And this has come to be called neuronal Darwinism. So We want to reinforce the strongest neural pathways, the positive neural pathways, because then what happens is these other pathways that are wired around stress and overactivation start to wither away. And that's what's called plasticity. That means that we can have an impact on these neural pathways in the brain. So exciting stuff.
Yeah, I agree with all that you've said. And, I've actually had people challenge me on this and say, look, I've had horrible, horrible childhood trauma.
Mm,
My amygdala is on fire. It has been since early childhood.
yeah,
There's never any chance that it will ever not be overstimulated and overfiring. And I resent the fact that you're telling me, Amy, I can basically think my way into a new state of being. And, you know, that they really did not appreciate me saying what you just said. So what do you, I'm asking you all the hard questions, Mala.
no, oh, I think I love it. I just love it because that is so, so important. And the truth is that, at least in my world opinion, my small world opinion, honestly, I think the truth is that anybody who has a defense structure in place where their amygdala is flaring, it's there for a reason.
Mm,
It's there for a reason. It protected them, who knows from what? Years of perhaps emotional and psychological abuse. So it's very important that we not push down that wall of removing defense structures, which are important, which played a role, perhaps still plays a role because maybe the unconscious hasn't gotten the message, or even consciously, we haven't gotten the message yet that the war is over. The
and
emotional
in,
and
in
yeah,
some cases, there may still be a war going on because we know that if we've had abuse or trauma, we sometimes end up in adulthood back in similar relationships to the abuse or trauma we had as a child. So it's very
absolutely.
possible that the war is not over.
Absolutely. And so what I do is I think it's so important that we get out of top down only interventions. We have to be trained, I think, that if we're going to work in this field, we have to understand exactly what you're talking about. Like when it comes to trauma, are there other avenues which we can help that person impact, perhaps through the neural platforms,
Right.
instead of the cognitive platforms? So, in other words, yes, we can set an intention. Yes, we want to heal. Yes, we want to get over rage. Yes, we want to get over clinical depression. Okay, fine. Let's put aside for a moment any cognitive intervention. Okay. Let's just see if we can insert into the neural platforms a way to deactivate the sympathetic arousal or the dorsal vagal complex. That's an overactivation. Can we find a nice place and powerful techniques to just activate and then go from there? So if we have time, I would love to show everybody one breathing practice that is very powerful for bringing the ventral vagal complex online just like that. So I think it's also important, and this is where, when I was saying earlier that I love to do educational moments in my class, because I really want people to understand we have to name it to tame it, number one. And then number two, if we can help a person understand that there's two processes going on. One is that when we're overstressed, we're activating stress hormones, cortisol, adrenaline, noradrenaline. when we shift that and take that pressure off the gas pedal, and we start to balance the brake and the gas pedal, then we have the power to activate calming, more relaxing hormones. And I use the acronym DOSE to define those: dopamine, oxytocin, serotonin, and endorphins. So if we shift a gear here and we get out of the cognitive revamping, although that's important, it just may, yeah, it's very important. It just may not be the front and center intervention. It may need to be a secondary intervention.
Well,
And
can I just add, I think it depends on the person too. This
absolutely
top-down cognitive approach is really powerful for some people. They grasp onto it and it makes sense to them and it changes their lives. And other people, it actually re-traumatizes them.
yes.
And oh, now I'm a failure at this, right? So then they're needing what you're about to show us, which is the bottom-up approach, where we reteach the nervous system and the body how to feel differently, how to sense differently. And for them, that's a much more powerful intervention.
Absolutely. But just to help people think and understand and experience that they can activate calming hormones, that they can activate dopamine and endorphins, and those feel good. And then when we do, we are not in that amygdala flaring threat space. Our consciousness shifts, So I do think that that's important for people, that we just, whoever is in this field, whether you're a psychologist or a medical person, or you're a yoga therapist, or you're a yogi, and you want to make an impact and you want to help, heal, we have to understand that there are options for top down, bottom up, and that not everyone's going to be the same, like you said. So, yeah. So is this a good time to?
It's a great time.
Okay.
I love that we're doing little practices.
Okay, that sounds great. So what I'd like you to do is, if you could just take a moment and just lift the rib cage a sliver, so that there's a better capacity for the diaphragm muscle and stomach to work. So the first thing we want to do is, just, if you're comfortable, close your eyes. If you're not, you can just look down and just go to some stress points, like around the eyes. Let them relax, the eye muscles and all the muscles. Relax your cheeks and your tongue, and letting the jaw release, and letting the shoulders drop down. So 3 high stress points: eyes, tongue, shoulders. Drop down. Now the inhalation on this is what's called a double breath. So we're going to inhale normal 50% of the way, and then we're going to go into the second breath portion. So it goes like this. We're inhaling, and we just do that extra gear where we inhale a little fuller on the inhalation. So that's the inhalation part. Double breath. Breathe in, second gear, breathe in deeper. Okay, then the exhalation, we're exhaling through the mouth. Stomach goes in, and then take a minute and pull that diaphragm in and slightly up. So it's stomach and diaphragm. Okay, so we'll do it together once, and then you can do it on your own a couple of times. Okay, so ready? Inhaling, 50%. Inhale, second gear, deep breath, tiny pause. Exhaling through the mouth. Stomach goes way in, and then activate that diaphragm in and up. And now you can do it on your own, at your own pace, maybe 2-3 times. Make sure that diaphragm goes in and up on your exhalation through the mouth. And take another 10 seconds. You can finish up and have a moment of observation. Just notice how it changed the chemical response and our neurobiology, feeling more relaxed. And then you can slowly open the eyes and come fully back. So I don't know about all of you, but every time I do this, I get that dopamine, that bliss hit in the brain. And what's happening is that the reason I was differentiating the stomach and the diaphragm is because a lot of times people are taught to do that 3-part deep breath, stomach, chest, shoulders. I've revamped this from studying neuroscience. So now what I do is stomach, diaphragm, chest, because when we pull the stomach in, it doesn't mean we're activating the diaphragm in the full capacity of what we can do with it. When we do it in the full capacity of what we can do and we bring that diaphragm in and up, guess what it does? It releases a spurt of dopamine in the brain. That diaphragm is in a direct correlation activating on that vagus nerve, and we get a hit of dopamine that happens. When we're doing that inhalation and that double inhalation, I don't know if you noticed it, but boy, does it fill up the alveoli so beautifully. And again, we're activating all sorts of neural mechanisms and neurochemical processes in the system to take our foot off that gas pedal. So if you feel like a little bliss brain, then you were successful. And if you didn't, don't worry. Sometimes it takes just a little bit of practice to do it.
I'm in complete agreement that the exhalation needs to start at the bottom and exhale belly, rib cage, chest, and out. I mean, that's
Yeah.
what we were taught in India. And like you said, now the neurobiological research is starting to prove that.
Yeah,
Um,
absolutely.
and I really feel, mini gentle Uddiyana bandhas or Mula bandhas, not where, we're going to take a yoga therapy client and lock all the bandhas for 24 breaths, not like that, but just
Right.
as you were showing, just pull it in a little bit and pull it up.
Mm-hmm.
That is one of the best ways that I've seen to get people out of that dorsal vagal response where their legs are numb and they can't feel their lower body. It really brings attention, awareness, and muscle contraction to those areas and
Yeah.
oxygen, right?
Yeah, absolutely. Absolutely. And again, it's just so exciting because even doing the bandhas, the way that I explain the bandhas, the Maha, I think it's called the Maha Bandha. Is that,
Yeah.
yeah. Okay. So the Maha Bandha are the 3 bandhas, and what I say, so simple, because, I like to keep things simple and easy to understand. I just tell people, take the pelvic floor, move it in and move it up. So it kind of gets, I think, to the point. And then the stomach goes in and up, the chin goes down toward the chest. What are we doing? We're totally activating the vagus nerve from the bottom all the way up to the neck. It's vagal nerve stimulation. The vagus nerve, for those who may not know, makes up about 80% of the parasympathetic nervous system, which slows down the body. Easy way to remember it: sympathetic, speed. They both start with S, sympathetic, speed. Parasympathetic, slow down. So those 3 bandhas, what we're doing is we're activating vagal nerve and vagal toning. That's what we're doing. Humming activates the vagus nerve. The Brahmari breath, that activates the vagus nerve. There's so many intersections when we really start to look at neuroscience or look at yoga through the lens of neuroscience. All sorts of things open up, and yoga becomes this like amazing practice that we understand from a neurobiological and a neurochemical, in a neurochemical way. So I just find that really, really exciting.
And how wonderful to have decades and decades of experience at this point in time in the area that you are so passionate about, while modern science has decided to study this. Because if you were here 100 years ago, Mala, you could be hypothesizing all of this, but without the actual scientists and researchers coming in to show that
Yeah.
humming increases nitric oxide, which has an impact on your immune system. Without that kind of knowledge,
Yeah.
it's not as exciting as it is right
Yeah,
now.
exactly, exactly. And I think that's when this field just exploded. With the advent of new technology and brain imaging, the fMRIs and the QEEGs, we can see into the brain. We can see what parts of the brain are lighting up, under what conditions, what mood states, and so on. So just as a small example, when we think positive thoughts, we can see the left prefrontal cortex lighting up. When we're thinking negative thoughts, we can see the right prefrontal cortex lighting up. So, the advent of new technology and imaging process has really opened up the field quite dramatically.
Well, I am so grateful to have had a taste of your knowledge and your wisdom this morning. It's just the beginning because you have this teacher training course, Neuroscience for yoga teachers, that you'll be running yearly, bi-yearly. What's the plan on that?
Yeah, right now I think we're going to do it yearly. So chances are we'll do it next spring again, spring or maybe early summer. And people can check my website, cardiacyoga.com, and see what programs and when the training programs are going to happen. So, yeah. And if we have a minute, I would love to share a concept and a story that bringing in the yoga piece that I do think is really important. Do we have another minute?
I have time. Do you have time?
Okay. Yes, I do. I would love to share this story because I just think it's so powerful, bringing in the yogic angle on things. So I think most people are familiar with Van Gogh and his work. He was one of the most influential Western artists ever. And I think everyone knows Van Gogh was just struggled with mental illness tremendously, and lots of issues and problems. And he said 5 words that I just found profound and powerful. And when I heard this by watching a documentary that I was watching on his life, everything in me went, what? Wait, what? That's yoga. So, what were the 5 words that he said? What he said was, I paint to not think. I paint to not think. So, how brilliant is that? Because that goes to the heart of a yoga practice, Pratibhaksha Bhavana, changing negative thought patterns into positive ones. But we can't just do that by inserting positive thoughts necessarily. Sometimes that works, and sometimes we have to do positive behaviors that take our attentional faculties to a certain point. And when it's at that certain point of attentional faculties and dristi, which is the tradaka, the focusing, the concentration, magic happens in the brain. Our circuitry starts to more relax. It gets out of negative circuitry and wiring. And we see the ventral striatum, which is part of the reward circuitry, we see that start to light up. But it takes the concentration of the mind, intention, sankalpa, and attentional practices. But behind that, the Pratibhaksha Bhavana, the wanting to do it and move into more positive behaviors and thoughts. So just wanted to share that little story because I think it ties it together beautifully, how we can use the mind to heal the mind, how we can use the mind to heal our emotions.
And what you just said is exactly what Patanjali's Yoga Sutra says, right? That now we begin yoga. We're going in a new direction. Are you willing? Are you ready?
Mm,
Or do you want to just keep going down the road you always have, right? And then
right.
it goes into yoga is chitta vritti nirodha. Yoga is one pointed focus.
Yeah, yeah, absolutely. And that's where we all have to make a decision. You do what blank in order to not think those negative circuits and activate the negative circuits. So whether, like for me, I love playing softball, volleyball, tennis, I play, and your mind has to be so focused, especially when you play against men in softball, and they're slamming that ball down the third base line, thinking that you're not going to get it. You have to totally 100% concentrate. This hard ball is coming at you at 100 miles an hour from a very short distance. So you can't be thinking other things. You have to concentrate. And that's the practice that we bring to our asana practice, hopefully every day. We loop through, what I teach my patients and students and clients. When you're holding that particular pose, run it through. What's happening in the three B's, the body, the breath, and the brain. Because when that's aligned, we get the fourth B, which is bliss. Body, breath, brain equals bliss. So that might be a good note to end on.
It is, Mala. Thank you so much for joining us today. It was such a pleasure to just
Thank you.
be with you and to learn from you. And again, your website is
www.cardiacyoga.com.
wonderful.
Or you can go under positivehealthsolutions.com. Same thing. Yeah. So thank you, Amy. It was so wonderful to be here and chat with you about all these exciting things that are happening. And I know you yourself, you are a pioneer in this field, and your work is amazing, and your school is amazing. So many kudos to you for bringing these ancient practices into our modern world, our contemporary times, and inserting how we can heal in the best way with the most people. So thank you to you, and thank you. Yeah, thanks for having me.
In about a month, you and I will start our mental health, brain science, and yoga 30-hour IAYT approved professional development course online.
Absolutely.
And people can go see more about that at www.yogaville.org.
Sounds great. Well, thank you. Thank you so much, everyone. Namaste.